Family-focused nursing provides community health nurses with a unique opportunity to intervene in promoting and preserving the health of families. Once a community health nurse identifies the concerns of a family, she then continues to work in an active partnership with the family to plan and execute effective intervention strategies. This video program focuses on various aspects of family nursing interventions within the context of community health nursing. You will observe frontline community health nurses as they share their insights and their practice stories, enabling you to see how family health is promoted in the community. How can we conceptualize family nursing interventions in community health nursing? First of all, intervention is not a phase in a linear process. Rather, assessment and intervention usually occur concurrently in a more dynamic process. As well, the whole family is the focus for interventions, not just one or two family members.
Family-focused interventions involve all members of the family, so the interventions are applied considering the family as a unit, as opposed to applying interventions to individual family members. You might use family interventions when, for example, there's some dysfunction in the family or there's some identified issues that is affecting each family member as opposed to an individual. For example, when I go on a Healthy Beginnings long-term follow-up visit, we often assess the family's coping skills, their social supports, financial abilities. For example, I've went on a visit and have noticed, a mom showing signs and symptoms of postpartum depression. Further exploration of those symptoms have revealed there's financial difficulties. And then the financial difficulties have been related to an addiction issue for the father. The father's having issues with gambling. So when we have variety of factors kind of affecting this family, then interventions need to be applied, taking into consideration all family members.
When you are working one-on-one with an individual, you're just dealing with that person, their personality, their beliefs, their coping mechanisms. But with a family, you're dealing with different personalities, different backgrounds.
Another important point is that interventions are not something that the nurse does to the family, but is something carried out in partnership with the family. Hallberg's view of family nursing interventions illustrates this perspective when she advocates for nurses to see families as experts on their own lives and situations. Hallberg also maintains that nurses need to cooperate with families in intervention strategies. Critical to this cooperation is the nurse-family relationship itself. This relationship can either enable or it can inhibit reciprocity between the nurse and the family. The nurse's facilitative role is crucial in the nurse-family relationship.
I develop a facilitative nurse as partner role by encouraging and empowering all family members to be involved in their care, helping them realize that it is their right and responsibility to be involved in their health care. I think the authoritarian role of the nurse is more likely to result in the family being passive and not willing to be involved in the care and may decline future follow-up.
The importance of focusing on strengths and assets in family nursing interventions cannot be overemphasized. Rather than seeing families as dysfunctional, multi-problem, or high risk, the nurse needs to see families as resilient and competent, albeit this competence may need to be drawn forth by the nurse.
You have to work with a family to identify their strengths and their weaknesses and work with them and their strengths to make sure the family has everything they need to be able to function in the way that they should.
To include families in determining their own goals, I think one of the most important steps is to have them identify any issues or concerns that are present and altering family dynamics at this time, as well as getting them to brainstorm and think about possible solutions and interventions. Just because I'm not aware of the family supports or their strengths. So by getting them to brainstorm and think of possible solutions, they're also making me more educated and knowledgeable about their family dynamics and ways, of course, to address the current issues. I also stress the importance of having their goals simple and achievable, just so they don't set themselves up for failure. An example that I could provide is working with a mom with postpartum depression. You know, mom has no interest to go out, to do anything. She's just consumed by her emotions. Has a child, however, still, you know, not wanting really to provide much care for the child and would rather stay at home. And through, you know, having that mom set goals, just simple goals, such as, you know, go out every day for an hour. And in order to make that goal achievable, I had to brainstorm with her to see, okay, so in order to do that, what supports do you have in place? Do you have family supports? Do you have a family member you can rely on to come in to stay with your child for an hour? And then by starting out with simple steps, you know, and achievable goals, and they're able to move on to something maybe a little more intense next time.
Working with the family's strengths involves the concept of empowerment. Sometimes nurses may say, we empower our clients to take control over their own health. However, a more precise way to see the nurse's role in empowerment is to see the nurse as creating an environment in which the family can become empowered. The nurse can create that environment by responding to a family's identified needs and concerns, promoting the family's success, for example in mobilizing resources, having and expressing a positive stance towards the family, and promoting an atmosphere of joint responsibility for acting to impact on the health of the family. There are a myriad of possible interventions for the community health nurse to engage with families in the community. Let's look at some examples of common interventions. Perhaps two of the most frequent are education and anticipatory guidance.
In my practice, there are many you know, upstream approaches that we can take in an effort to prevent, I guess, future problems for the family. An example is anticipatory guidance. That is used quite often whether I'm in a child health clinic appointment or at a home visit, you know, conducting Healthy Beginnings long-term follow-up. The anticipatory guidance, you know, whether it be talking to parents about you know, their child's growth and development, making them aware of future changes that are about to happen. This prepares the family and gives them guidance as to how to prepare for the next stages ahead, and that can be very important in you know, reducing parent stress.
We do provide a lot of health promotion teaching to parents, and so, you know, being able to convey that in a way that you're empowering the parent, you're not telling them what they're doing is wrong, but you're showing them what that they can do to, you know, promote the development of their child, and you know, teaching them the skills that will make them feel better as a parent, linking them to parenting classes, linking them to community resources that will allow them to be with other parents.
I have had some recent experience with a family in which mom and dad both have mental illness. So of course in this case, a child, new baby born into this sort of family would be at high risk for some developmental problems and possibly mental health problems. So we have to intervene early, and one way we do this is admit the family to long-term Healthy Beginnings, of course, if they're willing to participate. And in that way we can offer guidance and support from birth to 5 years. We also educate the parents about their illness and the effects that it would have on the development of a child, and ensure that the parents know that positive interactions and lots of interactions with the child is one of the best things that they can do to ensure the child's development is the way it should be.
Community health nurses need to be aware of available resources within the community, both professional and non-professional. Referring families to these resources may be very effective in helping them to